For this, you don't have to do that, do you? Wear all that?
I think we do.
You do.
Might as well just keep it on.
Yeah.
Okay.
They can't hurt, right? They can't be like, no.
Mm-hmm.
The only thing, really the worst that'll happen is your goggles start fogging up, which happened to me.
That happened during sim.
Okay, so this, same thing, this is sterile. So you're going to open this up. Your gloves should be on top. And you will get to use nice new kits, so the gloves will be in there the right way. So this is just to set up your sterile field. And I just like taking everything out so I know what I have in here. Again, I would take in an extra pair of gloves just because these are really uncomfortable, and it's easier if you're in a pair of gloves that you're comfortable in. So then what you're going to do is these 3 Q-tips are going to go in one of the small basins because that's where you're going to put the saline. Then you're going to have another one of the small basins that has half hydrogen peroxide, half saline, and then the big basin is going to have all hydrogen peroxide. Again, they're not going to be watching to see which one you really pour it in, so if you can't remember exactly what goes in what, it's not a big deal.
They technically have us do 2 salines.
They did.
Because the new evidence-based practice is that the peroxide's going to cause breakdown.
Okay, so whatever they want you to do now. So just at least know that the saline is what the Q-tips go in because that's what you're cleaning the skin with. The idea behind the hydrogen peroxide is that that's what you're putting the catheter in. So if you think about when you get a cut, you clean it with hydrogen peroxide because it bubbles and gets all of the gunk off. And then the half strength is what you're scrubbing it with technically, but whatever you guys want to do. Then I would put this in the big basin so you remember that's where you're putting the catheter. And then here you have just the gauze, and there should be one that has a slit in it, which is the one that you put around the trach, which they must have used. If for some reason there isn't one in there, which there should be, you never cut this because the particles can go into their trach. So you would just fold like 2 pieces and just put them on either side. Mm-hmm. Okay? So now you're ready to start cleaning. The same thing with this. You're going to keep one hand dirty, one hand sterile for the most part. So you take this. The one that you should have on the practical is you just turn it to the right and it pulls right out. This one has things on both sides that you just squeeze in and then it pulls out. And just kind of twist it a little. And then drop it in the hydrogen peroxide. And I would just put their oxygen back on.
So you keep your dominant hand sterile right now?
Yes.
Okay.
So now what I would do is I would take, first, I want to do this. So now we take this out of the hydrogen peroxide and you take this with your sterile hand and you want to go in and clean it, which this is kind of awkward for argument's sake. You've gone through and you've done this. Never go like this though, because now you've just contaminated your hand. See, because this is your sterile hand and it's touching the catheter. Mm-hmm. Okay, so you clean it. I would say bring a garbage so you have one right below you so you can just throw stuff away as you're using it so you don't contaminate yourself. Then this goes in the half strength. And then technically this is where you dry this all off and you can still touch everything on here because this hand is still sterile. Now, here's the thing. Did you guys ever ask what you should do about putting the catheter back in? You do treat it off like that? Okay, so when you put it back in, you need to use your sterile hand